I'm Kelly Phillips. I'm one of the nurse practitioners that works with the Chattanooga Heart Institute. I work primarily with the electrophysiology team, and that is a group of doctors that specializes in heart rhythm issues, as well as patients requiring pacemakers and defibrillators. One of the main issues that we come across is atrial fibrillation. The very common abnormal heart rhythm affects greater than 2 million Americans. Some risk factors for atrial fibrillation are age over 60, prior heart surgery or heart disease such as heart stents, congenital heart defects that have required repair, high blood pressure, obesity, and sleep apnea. Treatment strategies aimed for atrial fibrillation include, if the patient is quite symptomatic or having difficulty, we aim to get the heart back in a normal rhythm. Several options for that, including medications that can help with that, procedures such as cardioversions, or even electrophysiology studies and ablations, where they use catheters inside the heart to make scar tissue and prevent the abnormal signals from getting across. Some patients are not symptomatic with atrial fibrillation, and in those patients it's important to make sure that the heart rate is well controlled, and we do that with medications and assess their risk for stroke. Atrial fibrillation makes one more prone to having stroke because of the blood clots that form inside the heart from the abnormal rhythm. And folks can have clots in the brain, which is a stroke, blood clots in the lungs or in the legs, and those patients that are at high risk will need to be put on a blood thinner.